The second one is quite common. So varicoceles, you've probably heard me use this term before, which is basically just a fancy way of saying vein enlargement in the scrotum. And it's a problem for two reasons. One, it can actually cause physical blockages for sperm getting mixed into the semen when it's on its route out. And it can cause some minor heat production. And if you haven't already listened to our episode on how heat can impact sperm parameters, testicular heat specifically, go back and listen to episode 101, which I will link in the show notes if you're listening to the pod, and I'll pop up on the screen here on the YouTube video for you. But if you haven't checked that episode out, we share a lot of really great research that we have around why heat can impact male factor fertility, and varicoceles being a dilation and a collection of blood in the scrotum. Naturally, there can just be some minor heat produced, and that can also have a trickle-down effect in not just sperm count, but all other aspects of sperm parameters. Finished off this episode, go check out 101 if you haven't listened to it already. Varicoceles are fairly common. 15 to 20% of men and just in the general population can have a varicocele. Oftentimes, they might not even cause any problems. They might not even know that they're there unless they feel something different. But in the infertile male population, to 50% of men who've been diagnosed with infertility have also been diagnosed with a varicocele. So it's a very common issue in terms of impacting male fertility that we, again, aren't seeing being at the top of the list, being properly diagnosed, being looked for when we're doing a thorough workup. Some symptoms you might have beyond just low count and low motility is pain or heaviness in your scrotum, distension, testicular atrophy, so shrinking of your testicles, and maybe a little bit of warmth. But a lot of men truly don't, that I have in our practice in FCM that have been diagnosed with varicoceles. A lot of them don't have any other symptoms. They're just found through investigation when we're looking for root cause reasons as to why their sperm parameters aren't great. Whereas I find if we leave them and we don't do any surgery, it's later in life when you're a bit older, maybe they've grown, that's when people tend to start feeling any sort of discomfort. So we actually got this question inside our office hours in FCM. I run a daily office hours to answer all of your questions. And someone had asked, if we opt to not do the surgery, what are the risks? And that's just one of the pieces is like, it might not be bothering you now. You might not have any pain, discomfort, or atrophy, but it could develop. So that's just always something you want to keep in the back of your head when you're making the decision of where do we go from here. Because of the heat aspect, it's not just count that can be a problem, but motility and morphology can also be a piece of the puzzle. So we want to look at all sperm parameters when we're talking about varicoceles.